Hello, Apurva.
Hello, hello. We'll wait for 5 minutes
Yes.
for people to join.
Sure. Yeah. My audio is okay, right?
Yeah,
Like
yeah.
audio, video.
Yeah.
Yeah. Yeah. It's been so long that I've never done a live. This is my first live.
Yeah, no problem. We'll do it. Today we'll have a nice session. I think people are joining. Hello, everyone. Thank you for joining. Let's begin then. Before we begin, I want to introduce you all to Dr. Swathi. Dr. Swathi has completed her BNYS, graduated from SDM CNYS. That is the same college. She's my classmate. She's my friend. And she has got training for integrative medicine in the reputed institution for integrative medicine program. And also she has worked in a natural birthing center at Chennai, and she's currently working as a medical officer and consultant at her own naturopathic and wellness center, that is the Swasthya at Chennai itself. And she's helping people with yoga and naturopathy, and also she has profound interest in the researches, and she's trying to provide health to people and help them live a disease-free and almost a drugless life through the proven system of medicines with the proven treatments. So first of all, let me tell you why did we choose this topic. Because first thing is, it is very less spoken. Usually we talk about food, we talk about exercise, sleep and everything. We talk about the physical aspects of our body, but most of them forget about the breathing. Even if they remember, they train people in a wrong way. Many of them are doing pranayama, whom I know, they all say that yeah, we do pranayama, but when we see what they are doing, it's completely wrong. So that is how people are going wrong, even if they know that breath is important. So we chose to educate about this topic, and the one name I remembered is Dr. Swathi for this, because she's also having a lot of interest in yoga and she's currently practicing it for her patients. So that is why me and Dr. Swathi are here today to speak about this topic. So let us begin. Dr. Swathi, you want to tell anything about?
Yeah. So I mean, like, when I was thinking about breath, it's like the first thing that you start your life with. Like
Yeah.
the baby cries, and from then on till the last, it's like our breath, which is always with us.
Exactly.
So we can go probably 3-4 weeks without food, 3 days maybe without water. But how long do you think you can do without breath? And when we want to improve health, we always think about, what is the best food that I can have, and, like proper hydration, proper exercise, and all of it. But then at the root of it, I think, if your breathing is not correct and you're doing the best of the diet, the best of the exercise, and you're somewhere not getting that improvement, maybe it's your breath. Breath has, I mean, like, we'll be discussing today for sure, like how much it has an impact on your entire body, your mind, and everything that we can perceive. Breath has an effect on it, is what I, like I would conclude it as, like, everything that we think about, breath has an effect on it.
Definitely. That is
Yes.
how important breath is. Like how it impacts our physical body, or whatever we call it as. Like it has a lot of impact. As Dr. Swathi said, we hardly can be, like, not even for a few minutes, I can say, without the breath. But without food and water, we can survive for a very long time. So this is how much
So,
important this breath. Yeah.
and maybe, I would even like add here, like when people, think of eating outside, like, they're like, okay, I'm doing something wrong. Just like what fast food does to your digestive system, I feel dysfunctional breathing or having that shallow breath, that damage, I'm not exaggerating when I say, when you're taking those shallow breath, it is like eating fast food.
Yeah.
So, just as much afraid as you're supposed to be for those processed fast food, I think we should also be cautious about our breathing and, that shallow breathing. We'll discuss about it in
Yeah.
the session.
Like here, we are not even speaking about smoking and everything. You're just speaking about dysfunctional breathing here. Forget about
Yes.
smoking and many other aspects, the pollution and everything. The
True.
improper way of breathing itself is causing a lot of harm for us today.
True. I mean, I think even the lifestyle, I think that's why, I mean, like, otherwise, I think every animal in nature is doing good breathing.
Yeah.
I think it's only because of our lifestyle, our posture, that this has somehow changed. And, like this dysfunctional breathing has come in because of, I would again say, like this connection with nature. So when you're in nature, it's like, there have been studies done that shows that, you breathe automatically deeper when you're out in the nature, when you feel very relaxed. Just, I would ask all the people who are live also, just imagine that you're sitting under a tree, or, you're looking at a beautiful sunrise. How do you think your breathing would be, right?
Yeah, we wouldn't even like notice that we are breathing shallow or something because we are in such a calm state. Automatically, we'll be breathing normally and wonderfully.
True.
Yeah, so it
Yeah.
has lot of because of this. She said that dysfunctional breathing is so bad. Like, it's just like having junk food. When you talk about the diet, it's just like eating junk food. So how does it impact the body?
Okay. So I mean, like breathing, it's not just our respiratory system. So when you take a breath in and out, it's like the oxygen has to reach each of your body cells. And for that oxygen to reach, it is your heart that is functioning. So when you take a good deep breath, and there's good oxygenation that happens with that good deep breath, then your heart is less stressed. So your heart rate goes down. So, this has been clearly proven. I'm sure, Apura, you will be knowing, being, yoga and into the research. Yoga has always, like, proven that it relaxes us, it activates the parasympathetic, it improves the heart rate variability, is the first thing that we are looking at right now, right? Like most of the yoga papers so easily prove the heart rate variability to increase when they start practicing yoga. And I feel it's because of this, like how the breath affects our heart rate. So it's from the respiratory system to your circulatory system, it kind of relaxes your heart every time you take a deep breath. So from there, it is definitely going to affect your overall health, because, circulation is like the key.
Yes,
So,
yes.
when you're breathing deep, definitely your posture is good. Definitely the muscles are kind of relaxed. They're receiving good oxygenation. So breath is also connected to the athletic performances. Why do you think athletes are training their breathing? The swimmers give such importance to that breath, but not only the swimmers, like the marathon runners, the bicyclists, all of them know that breath is important for performance. So breath is not just connected to your respiratory system. You're learning. I mean, like, again, I am quoting yoga again and again, because in yoga, we are talking about breath. And we've seen that yoga improves memory, yoga improves learning ability in children. And that is also because we are again talking about breath here. With your every breath, your brain receives more oxygen, the learning capacity improves. So the brain is the one thing that utilizes the most amount of oxygen in our body.
Yes.
So, like when you're good, receiving good oxygenation, I think your brain functions get better. So everything is related to your breath.
Yeah.
So, like when I say that breath improves health, maybe, like it also is kind of affected in the people who are suffering from any disease.
Yes.
I'm sure you would have seen examples, right? Like yoga improving health.
Yes, yes, definitely. Like every patient, no matter what is the disease, which system it is related to, is not just some asthma or lung issues that we are prescribing breathing exercise. In every other disease, we are telling them to do pranayama, breathe properly, connect with the nature and everything. Because breath has a large impact on the diseases. Like, what is your experience regarding breath? Have you seen like how evidently it can improve your patient's condition?
Like one example that I cannot forget is one person came to me with back pain, and it was an online consultation. I think it was because of COVID. And then the only thing that she could do was following good diet and breathing practices. I was, because she had back pain, she was not sure of, doing it without direct supervision. So she didn't want to start any exercises. And her pain decreased like by 50% just with diet and good breathing, like pranayama. She kind of, swore by pranayama. Like, I do pranayama in the morning, I know that my day will go right. So that I mean, like the pain, sleep. Hundreds of people, like, their sleep improves when their breathing improves because they're more relaxed. Any disease that is caused by stress, I have seen that it improves with breathing. IBS, acidity, all of it. Like, because it's always a combination, you cannot pinpoint, but this one case where, she couldn't come down for treatment, I can for sure say that it is because of breathing. I mean, she also said that it was because of breathing. So I was like, wow.
Yes, exactly. See, it's not just we are telling, the patient themselves agree that pranayama is causing such a great difference in their lives. And when they do it, they can see that pain has been reduced. Like researchers are proving it today, but then we had this philosophy with us hundreds of years ago. Yoga had told it all. It is not only the physical body, the mind, and everything is controlled by breathing. That was given to us from a very long time, but somehow we have lost the touch of it. But researchers are proving it back again that it's very important for us to have the right breathing. When you talked about certain diseases like migraine or acidity or all of this, so basically we can conclude that they are all caused because of stress, and stress is the one which is causing a lot of diseases in today's world. So you mean to say that breathing helps to reduce stress, is it right?
Yes, breathing has a direct effect on stress because your every breath, you have two components, like, sympathetic and parasympathetic. During the sympathetic, it's like it contracts and it relaxes.
Yeah.
So, yeah, so the breathing and your heart rate variability, I meant to say. So, your every heart rate, it has one contraction, one relaxation. And that is connected to your breathing, like we discussed earlier, like, like every deep breath, it relaxes your entire system. So, coming back to the question of, like breathing and stress, right?
Yeah.
Yeah. So, I mean, like, when you're stressed, you're fearful or you're angry. So in, like in nature, what is stress to any person or any animal? Stress is you to either fight or flight. That's the basic
Yeah.
thing of stress, right? You either fight or you fly. So your body gives you the entire energy to the muscles and everything else, but not so it's only fight or flight. So parasympathetic is rest and digest. So what happens when you're stressed is you're breathing shallow and fast, and your heart rate goes high because it has to give that oxygen completely to the muscles and nothing else. Your immune system is gone for a toss. Your digestion system is gone for a toss. You're not able to relax. So all of this, and today for a man who's sitting in the office getting emails of, the to-do list and, the deadline, for him, stress is constant.
Yeah.
And because his posture is not right, he's not even able to breathe deep. Posture is also compromised. He's also stressed, and that stress is not where you can either fight with the boss or you can fly away from the boss.
Yeah.
So that stress is kind of like, it's just constant. Or, for someone who's at home, they have to send the kids to school, or, like they have a list of things to do, or they're just stressed.
Yeah.
So stress is something like, it's not like, oh, you have an exam and you're stressed.
Exactly.
So stress is something which is directly affected, and it's being compromised.
Yeah.
So our breathing has naturally become shallow. It's like most of us, like, 90% of us are breathing shallow.
Yeah, like stress has become that everyday thing right now. You might not feel that you're stressed. You may think I have a happy life, I've had a good day at work and everything. So, but still you are in that stressful situation. It may be minor things repeatedly, like you might be late for 5 minutes, or you might have a deadline to finish, or whatever it may be, or the constant stress of sitting at a place in a closed room and having less oxygen to breathe in. That is kind of stress
Yes.
again to your body. So everyone around, all of us are going through the continuous stress, and when it repeats, definitely it's going to cause the disease. And how can you relate this breath with stress?
So I mean, like, your shallow breathing, sympathetic activity is higher. And the more relaxed you are, parasympathetic activity is higher. So your breathing naturally becomes deep and slow when you're relaxed. And when you're stressed or you're fearful or you're angry, the breathing naturally becomes shallow. So just think, just using the power of the mind, think of a situation when you were sad. You're not even right now sad. Just think of a sad situation. If you notice very carefully, your breathing actually gets shallow. Just with the power of your mind, just imagine a flower in front of you, the most beautiful flower blooming open, and you'll feel relaxed. Your breathing changes. If you notice these two situations, if you put in your full power of the mind, you notice your breathing pattern. It changes every second. Like, it's that crazy and powerful, because your breathing pattern, the breath, the nostril in which you're breathing through, that changes. I'm sure, like, if all of you check, it is either one of the nostril that is dominating right now, and then it just changes automatically every 30 minutes to 4 hours. It changes to the other nostril. It changes back. So your breathing rate, your breathing pattern is so much in variation. And if this kind of that stress that Dr. Apurva also mentioned right now, like that constant stress that we don't know that we are in stress, and we are in a sort of stress. If you're in that constant situation for a major part of your day, your breathing is changed to becoming slightly shallower for a major part of the day, which is what we were mentioning as dysfunctional breathing in the beginning. So we are not saying dysfunctional breathing is where you are having a breathing difficulty, or no, nothing. I'm saying like 90% of the people are having dysfunctional breathing, except for the athletes, the people who are regularly going out for exercise, or who are very relaxed by nature, like there are people, like very relaxed by nature.
Yeah.
Except for those, I think probably most of us are doing shallow breathing.
Yeah, for that matter, me and you are also mostly doing shallow breathing, I think, for most of the time.
Exactly. Except for the yoga class time.
Yeah, definitely. So when we spoke about this mind and breathing connection, like as you said, if you think of a sad situation, immediately we start having a shallow breath. And what the thing I can recall is, like in yoga, we have mentioned how beautiful it has mentioned that the mind and the breath is interconnected. How fast your breath is, it shows how fast your mind is running. So all of these was given to us before, because we can't stop ourselves to connect to yoga, because that is what we have studied for these many years. So whenever we listen about something related to breath or body or anything, then we suddenly connect with the yogic learnings which we have learned or read throughout. So how beautiful it is that you can control your mind just by breathing. It is
true.
Not
and
so.
Apurva has been so inspired that she has named her clinic Prana Nature Cure.
Yes, definitely. Like prana is what it's not just breathing. Like when we talk about prana, it is like there is a difference between shwasa and prana, right? Shwasa is breathing and prana is energy. So how do we improve this prana is through breathing. That is pranayama. We commonly know the word. Why is it called pranayama? It is that prana, exercising your prana basically. So that is how you improve your vital energy. And really, it has inspired me. I've named my clinic Prana because that is the life force driving all of us every day. So it is very important. So now we connected so beautifully that this prana, as we said, it is not part of a physical body. It is a part of etheric body. Till now we have been speaking only about the physical body, but during conversation we'll somehow link to it that prana also can be increased by breathing. That means breathing affects not only your physical body but also your spiritual body or etheric body or whatever you want to call it as. Right? Breathing is so important. And the next question I want to ask you is,
Maybe I would like to add here, like, so breath is that connection between the physical body and the energy body, right? Like,
exactly.
Breath is that connection between the mind and body. Breath is that connection. So breath is that bridge that you can use to, control your mind, control your body. It's one of the things that happens involuntarily. So breath, you need not, but it is one of the very few involuntary activities in your body that you can control.
Yeah.
Like, how amazing is that? You cannot control your digestion. You cannot control your heart.
Yeah.
But with your breathing, you can control your digestion. You can change or regulate your heart rate. So that's how magical breath is.
Yeah, it is
One
a
of
tool.
the, yeah.
It is just like a simple tool which we all can do. And usually to people who have overthinking or mental issues, we tell them lot of therapies they go through and all of that. If we just tell them, just avoid your thoughts, start thinking positive, or control your mind, it is so difficult. Forget about mental issues, for everyone it is so difficult. But breath is such an amazing and easy tool that if you just control your breathing, automatically you are controlling your mind. And that is so simple and effective breath is. So as you spoke about, you also mentioned about the posture. So what is the correct posture for this breathing?
Wonderful question. I mean, like, it's like in respiration, diaphragm is supposed to be the primary muscle of respiration. But right now, if we ask even our viewers, observe your respiration. Do you think your diaphragm is moving? So the diaphragm is supposed to be really strong, and it's going to get strong only when we use it for our every breath. If you don't use it, you're going to lose it, kind of thing. So, if you see babies, their bellies move so nicely. You see dogs, their bellies move so nicely with the breath. So why it has changed is again the posture. So you were asking me about the posture. So when you sit straight and you breathe in and out only through your nose, automatically your entire torso should expand. It's your chest, your abdomen, your diaphragm, your back also will feel the expansion with your every inhalation, and for the exhalation it goes back. We'll be doing this practice. Let's do this practice at the end. So for every breath, there's you're sitting straight with your spine straight. So we are talking about the spine. Like, many of us will wonder, no, like, why are we talking about the spine when the breath, we are only feeling the expansion in the chest or abdomen. So you're talking first instructions. I'm sure all the people who took yoga, sit straight, sit with your spine straight, right? So when your spine is straight, all the muscles, the paraspinal muscles, the back muscles, all of them support, they expand with your every breath, and with your every exhalation, they relax and they come back. So your posture, so the muscles support, they make space, like they make space for the breathing to happen. Like, I would think of the entire yoga as a breathing class where you're working at expanding lungs in different ways.
Yeah, definitely.
Like making more space, relaxing, stretching those muscles.
Yes.
So improving your posture at the same time. So, sitting straight, shoulders relaxed, chin parallel to the ground, all the instructions, like a wide base, all of this, like, like you're sitting with your legs together, your back automatically rounds, your chin goes down. The opposite is, a wide base, like, the meditative postures that we have, Siddhasana, Padmasana, all of it, Swastikasana, all of it, wide base, spine straight, all the back muscles engaged, shoulders relaxed. All of this is your right posture for breathing. And the most important is that you're breathing through the nose.
Yeah. So while listening to this, I hope everyone has made their spine straight, so that we have a better breathing. As she's rightly said, the entire yoga class can be considered as a breathing class, because whenever we do any asana, we are stretching any part of our lung, and we are asking them to don't hold breath, do normal breathing, keep breathing normally. It's just because you are expanding different aspects of your lung and you start breathing in. And for those of you who haven't understood about the diaphragm breathing, I want to tell you again that diaphragm is a muscle which separates your lungs and stomach. So whenever your lungs are full, the diaphragm will go down and your abdomen will come front. That is, your belly will move forward. The lungs create space for themselves by pushing the muscle down, and that's how breathing works. So diaphragm is a very important muscle, as Dr. Swati told. So all of us can start practicing or just observing that when you are doing your proper breathing, your abdomen definitely moves, your belly moves in and out, and that is the correct way. And usually for sitting straight, they say that don't sit slouched back, you will get back pain. That is the only thing we know, right? Till today, most of them say that I sit so horribly, I have a terrible back pain. But none of us are realizing that it's not only about the back pain, but actually the lungs gets more space to expand when you sit straight, you're breathing right, and without you knowing itself, you are controlling your entire body and helping it to improve its health, right? And what is the right way to breathe? As you said, most of them are doing shallow breathing. 90% of us are doing ineffective breathing. So, what is the right way to breathe?
Okay, for this, like I have, so let's consider this is your lung. I'm not sure because of lighting.
Yeah,
Okay.
yeah,
Yeah?
yeah. We can see it. Yeah.
Yes. So imagine your lung capacity is 6 liters. Okay, so the entire thing is your lung capacity, and residual volume. So 1.2 liters, you cannot do much.
Mm-hmm.
Your expiratory reserve volume, that is after your normal respiration, you can breathe out extra, right? Like you can breathe out extra after the normal that we do. So that's 1 liter. How much do you think we are breathing in and out with our every breath? It's just this much, which is 500 ml. And the entire 3 liters is your inspiratory reserve volume. So after our normal inhalation, we can breathe in a lot more. That's the inspiratory reserve volume. So we are doing 500 ml usually. 500 ml is the tidal volume that usually happens. So if you want to change, if we are doing shallow breath, what happens is we are doing the respiratory rate increases. So we are doing 10 to 12 breaths per minute if we are doing shallow breathing. For example, you're doing slow, deep breathing. So your respiratory rate directly comes down, and you'll be taking in the same 6 liters per minute of air, but you're doing the respiration only for 4 to 6 times. So isn't it what the athletes, all the athletes, if you ask, their aim is like, bringing down their heart rate, right? Like, my heart rate is 55 after I did this and I relaxed, my heart rate is 55. And we also know for sure, like athletes have a lesser heart rate, lesser respiration rate. Like their every breath is so effective. Their metabolism of the body improves so much that your every breath is that effective. It oxygenates. So, your nothing is working extra, nothing is working hard. You're not pushing anything to the limit. So all of it is very relaxed. Your breathing is deep, nice, long, deep breath. So in yoga class, if you see, like whenever we are doing a posture, inhale, take your hands up. So that's going to take, you would be doing probably 4 breaths for every minute. I'm sure not more than that, because you're supposed to go from posture to another posture. Automatically, for the entire yoga class, your breathing rate is 4 to 6 per minute, when normally we are doing 10 to 12. Sometimes it goes up to 15 when we are stressed. You can just observe your respiration rate by like keeping your hand over your chest and observe. Whenever you're stressed, your breathing rate increases. Like it could go up to 15, 20. So what happens? Your entire body is stressed. So this is the capacity of the lungs, the entire thing, and we are using one tiny bit of it. So we can do deep breathing, use more of it,
Yeah.
and be benefited. The entire metabolism, like the breathing affects your entire metabolism.
Yeah. Like basically lungs are providing oxygen to your heart, like to your blood and everything. And just imagine the only 500 ml, as you said, that is the only amount we are inhaling, and through in that we are giving oxygen. Only so less amount of oxygen we are supplying to our all the organs basically. So
Correct. So like the reserve volume is that much.
yeah.
So if we could use at least another 200, 300 ml from the reserve volume and 200 ml from the expiratory reserve volume, I think we are going a long way. So our every breath, we are using 200 ml more, just 200 ml, like, small changes at a time, small improvements in your breathing at a single time. We are not asking you, we cannot even use the full breathing capacity because the residual volume is never touched. So, all that we are asking is that extra 200 ml, bringing down your respiratory rate from 15 to 12, 12 to 10, gradually.
So
Yes, and
deep breathing, but again, it shouldn't be forceful, right? Like I have seen some people doing like very forcefully with that sound and pressure, and it creating more of stress into their bodies. Like I have watched so many people doing pranayama, like fully frowning their face, and they do it. I think again that shouldn't be the case. Automatically,
true.
if sit straight and be aware of the breathing, they can improve that breathing pattern.
Yeah.
And what about
So when I am teaching breathing to my patients, or anyone, I tell them, like, imagine it's like a flower that's blooming open. Your breath should be like that, like it should be that slow, that gradual, that beautiful. So you should feel that beautiful, and I think when that is done, like, or another example is the sun rising. It can be that slow, that nice.
beautifully? It makes us feel so happy by the imagination of that flower blooming. That's how our breath should be. That so slow and down, not disturbing anyone around.
True. Like, how would you imagine Buddha's breathing, right? I mean, like, that is what we are trying to achieve with all of this, right? Like, achieve that Buddha state of mind. So, Buddha is never going to do that forceful breathing. So, it should always be slow, deep. I mean, like, in the initial stages, if this is your first time that you're practicing, I think better go to someone who really knows and then learn from a trained person, I think or anyone, who really knows what it is, would be a great teacher to begin with.
If you learn from people who themselves have learned from watching television, then it's a very tough time for you as well. So that's going to be a difficult part. And then I have observed a lot of people who are breathing through their mouths. It may be during traveling or during exercises. And how is it important? Like, what is the difference between nose and mouth breathing?
Wonderful question. I mean, like, so the nose, why do people start mouth breathing? Let's first kind of break that down. The sinuses are blocked and congested, so the nose is offering more tension. So they start breathing through their mouth because it's easier. But then, like, when these offer tension and you're breathing in through that slight tension. So if you observe, even now when you're breathing through your mouth, it's easier because there's no that slight resistance that's provided through these nasal passages. Open your lower lungs and they exercise your diaphragm. So, like, diaphragm, you can be conscious and exercise it, or you could do nasal breathing at all times. And that slight tension, it has to pass through constricted passages for a short while. That tension opens your, like, your diaphragm. The diaphragm pulls the lower lungs down, and it increases your respiration. Your breath becomes deeper when you're doing nasal breathing. That's one thing, as far as, deepening your breath is concerned. Apart from that, the nose is where you're supposed to breathe. The mouth is where the food is supposed to go in, because, these nose, they have sinuses which produces nitric oxide, which is a potent vasodilator. Like we said, breathing and oxygenation and your heart, all of this is, like, definitely related. So when nitric oxide is a vasodilator, what does it mean? So you have blood vessels all through which, every cell has to receive oxygen, right? These blood vessels are going to carry this oxygen. So when this vasodilator, this nitric oxide, when you breathe in through your nose, it goes in, it gets circulated to your entire body, and that is going to vasodilate. That is like vasodilation is, these are going to dilate. So these are not in tension, basically. So they are going to receive oxygen easily. So when nitric oxide is there, your heart need not become stressed to deliver oxygen to the last tissue in your body, your toes, your brain, all of the eyes, the kidneys, all of those have very tiny capillaries. And if they are vasodilated with the help of this nitric oxide released from your sinuses, maybe it's too much for an Insta live, but this is what happens. So this nitric oxide,
like, who had imagined that just by taking breath you can do vasodilatation of some organ which is at the other end of your body? Like, the mechanism is so wonderful. Our body is made such a complicated and beautiful way that, as she's saying, that nitric oxide, it increases the vasodilatation, that basically you can just think like it will avoid you from having a high BP. Yeah, that is the most simple you can understand.
yeah, nitric oxide is like, it's like the go-to. Everyone is looking at how to increase their nitric oxide. Breathe through your nose. Not just that, so this nose also has this mucus. Mucus is the first line of defense. So when you're breathing, every time you're breathing, so we wash our hands every time we eat, but there's no one who's washing the air, right? So we are breathing in trillions of organisms along with air, the microorganisms, bacteria. Mucus is the first line of defense. Only when you breathe through the nose, the sinuses, the mucus there traps the dust particles, traps. So there's so much dust. Like everyone knows, we are surrounded with dust. We see our tabletop, our chair. If we don't wipe it for like 1 week, we know what happens, but no one does it for our lungs. When you're breathing in through your mouth, all of it, where do you think it's going? Directly without any filtration. All of us know the nose is doing a wonderful filtration job. It's adding that moisture. So when you're breathing through your nose, the water requirement reduces actually. It's like if you're breathing constantly through the nose, 40% of hydration happens here. It's like for a day, it's like drinking 1 liter of water, I would say. Hydration. And then it moisturizes the lungs. So, the lungs don't get direct cool air. It warms it, it moistens it, sends it to the lungs. And also, because this is the pathway that the air has to go through, it gets more surface area for the oxygen exchange to happen, because this is the pathway it's supposed to go. That slight tension all through provides more surface area for every breath that you take. Your lungs are waiting to absorb all the oxygen that it can. So let's make it easier for our body by respecting our body and breathing through our nose consciously. See, like we have changed to mouth breathing because of congestion happening. We think it's easier. There's tension here. Who will breathe through nose? But let's kind of make congestion to go away with any other natural treatments, and kind of start training. At least let's realize this in this Insta live, that like nose breathing is so very important. And if we are not doing nose breathing, snoring, metabolism, all of this gets affected. It's your dentist. I mean, like, I think you were mentioning to me the other day. I think it would be lovely if you could share that.
Actually, when we were discussing about the session, I just told to Dr. Swathi that when I went to dentist for getting my teeth done, because it is slightly protruded, and when I consulted, he asked me about snoring. Are you doing mouth breathing? Are you doing throughout the day your mouth is dry or something like that? He asked me, and then I related that breath is so much important that it can also cause dental problems if you're not breathing. Maybe in childhood we were not aware and somehow we didn't breathe properly, and which has led to so many dental issues as well. In today, most of them I've heard that they have protruded teeth or crooked teeth or many other dental issues today. Like, we have not seen any tribals having dental issues, right? They don't even have a dentist, but they all have straight teeth, and their smile looks beautiful without having any dentist. Maybe they are breathing so well, and they are also connected with the nature so well. So this is one incident which reminded me that breath is so important. As she mentioned, like, nose breathing improves the moisture. Like, you can observe whenever you have a stuffy nose, where you have blocked nose, you feel like drinking water more, like your throat gets dry. And even for people who are having a habit of snoring, when they sleep, in middle of the night they get up and sip water, and even during their exercise they keep sipping water. because they are doing mouth breathing. If they do nose breathing, none of it is required because nose automatically provides hydration to them, as Swati mentioned. And this also can be seen in children. Like, what about children?
Yeah. So, I mean, like, as babies, they're doing such nice diaphragm breathing. And for some reason, if they change to mouth breathing, let us first look at the cause and rectify the cause is what I would say. And, train them to breathe through their nose after that. So, like you said, in children, issues like ADHD and, sinuses, asthma problems, all of this, maybe if we look at the root cause and, ask them to, compulsorily, like do this nose breathing training, kids adapt easily is what I have seen.
Yeah.
Because they've just like recently changed because of one issue. And if we ignore it or we don't bother about it when they are kids, as they grow up, it becomes an issue and they keep going doctor to doctor, finding a cure, and they don't know where. But as kids, if we observe that they're doing mouth breathing at night, like we wake up, like as mothers, like, they wake up, they see their kids doing mouth breathing, don't ignore it. Try to find the cause for it, and whatever it is, like try to find it and change it immediately so that it doesn't lead to any further issues, like, because as kids, it's very easy to change.
Yeah, definitely. And also, now before it was like only adults are having these issues because of the bad lifestyle, posture, and everything. But now we see kids are also having that, like from a young age, their posture is very bad. They have to read, and more than reading nowadays, people are doing on phone. They just give a phone to the child and say, just sit quiet, and that has harmed them because the posture is so bad. Even they are not sitting straight and they are doing mouth breathing, and such a young age, kids have started getting breathing issues and many other issues. I think if they are doing mouth breathing, the first step you need to take is correct their breathing, and rest everything will get fall in place gradually once you see the root cause of it. And how can we relate, like any other examples or something, like how breath has changed people's lives, or and how it is so important to them?
So the whole, the Western medical science looking at breath is such an important aspect. I think started majorly by Wim Hof. So he's called as the Iceman.
Yeah.
So what I mean, like, people are viewing this also. If you could go and look at YouTube for Wim Hof breathing method and practice it from wherever you are. Start slow. What he has done is, like, he challenges people. You give me, it's like he runs in shorts in ice, snow kind of thing, and he takes ice bath. So initially he used to take it for 2 minutes. Now he can tolerate it up to 30 minutes. So when they did a research on him, he maintained the temperature of his skin at the same 37.4 all through, even when the ice was in contact. He was in an ice bath. They took his skin temperature continuously, and the temperature did not go down because he was doing this breathing technique. So it's called as the Wim Hof's breathing technique. So all of this, like he also studied with the Tibetan medicine. So all the traditional practices, like yoga has it, like we've constantly been talking about yoga, all the traditional systems of medicine, the Chinese medicine, Tai Chi, Qigong, the Tibetan medicine, all of it talks about breathing. It's called as the fire breath, and different names, but they all are trying to say you change your breath and you can change your life. So I mean, like, this was the first thing that he proved, like, his skin temperature does not change. He can run in shorts in snow. And then what happened is, like, he was ready to take in E. coli into his system. So you're supposed to get an infection, your temperature is supposed to go high, all of it is supposed to happen when you take in a organism like E. coli into you. He did breathing, he took it in, he did breathing. He was unaffected because his immune system was so strong. He changed his immune system. He changed his body temperature just by breathing. So that guy has also been a huge inspiration, like reading about him and all of that. So
how people have started.
And he also says how it changes your mind, like, any depression, anything, he says just do this breathing, you'll be out of it.
And that's how Western
So
has been speaking about breathing nowadays, and I think Indians are also getting influenced by that now. But it had already been told in yoga. We had just ignored it. When you said about the infection, just it took E. coli and didn't infect him, and it improved his immunity so well. I just remembered that in COVID, during COVID times, everyone started doing pranayama because we knew that doing pranayama, breathing practices, breathing right will improve your immunity. We all knew it. So that's a best example, right? Like
correct.
most of you have done the breathing exercise during COVID to improve immunity. So definitely it's going to work. And also when you mentioned about the ice bath during the Wim Hof breathing, like ice bath is also popularized nowadays because of that vagal stimulation, right? Does just breathing also help in it?
Yes, I mean, that's the easiest way that you can, so, like in naturopathy, we talk about cold showers, improving immune system.
Yeah.
And this is like, he's just proven what was in our textbooks kind of thing, both for naturopathy, hydrotherapy, cold showers, and for yoga system.
Yeah.
Yeah. So your immune system goes up. So your vagal thing is like, parasympathetic activity. So when you're breathing deep, the parasympathetic component of, so you have autonomic nervous system, which is sympathetic and parasympathetic. So whenever you're stressed, your sympathetic is active. Whenever you're relaxed, your parasympathetic is active. So by terms like vagal stimulation, sorry, I got a call. Yeah. So by terms like vagal stimulation, they are trying to test parasympathetic activity. Hello. Yeah.
Yeah.
I think I received a call because of that.
Okay.
So parasympathetic activity has to go up is what they're trying to tell you. So parasympathetic is where you are rested, you're relaxed. So the term for sympathetic is fight or flight. They've added one more, fight or flight or fright. So your parasympathetic, two words that should sum it up is your rest and digest. So you're rested, your muscles are relaxed, your digestive system is working properly well. So breathing is the way that you affect your heart rate variability, thereby affecting your parasympathetic activity. So higher HRV, parasympathetic activity is higher.
Basically, if we
Yes.
breathe well, we are able to rest well, our stress levels are maintained, we are normal, and we are also able to digest well. That is what is the conclusion to this topic. And at last, we'll speak about how do we do this in everyday life? Like, what are the practices we need to follow to correct our breathing?
Okay, let's just do probably two of them. Okay. Just a minute. So maybe all of us can sit straight, shoulders relaxed, eyes closed. Let's open our eyes. Let's place our hand exactly at where our diaphragm is. So exactly there, like this.
Above the waist, like just below your chest.
Yes. Yes, just below your chest. Perfect. So breathe in. Breathe out. So you're consciously trying to expand it as much as you can with every breath.
And people are doing, I think you can just mention in the comments below that what can you observe. You can just
yes.
I think if you have done it, you can see that your hands moving apart, you're expanding your chest. Not only chest, the diaphragm, the abdomen is also expanding. So you can see that. So that is one simple way to do deep breathing. And what else can they do?
maybe just block one nostril and breathe through the other nostril for 5 times. Block the other nostril, breathe through the other nostril for 5 times, and then observe if there's any change in their breath. So before we start, let's just observe how our breath is. Don't modify the breath at all. Just observe how your breath is. Feel free to close your eyes and observe your breath just the way it is. Now with your right thumb, or whichever is your dominating hand, close your right nostril. Breathe only through your left nostril for 5 breathing cycles. You can do slow, deep breathing. Consciously, aware of that slight tension in your nose when you're doing the nose breathing. Feeling the diaphragm expand, the exercise that we previously did. Consciously being aware of that part. Continue at your own pace. Once you're done, the other nostril, you can close with your ring finger and little finger. Close your left nostril. Do the same thing. You're breathing only through your right nostril, feeling that slight tension, breathing in, feeling your diaphragm. You're exercising your diaphragm consciously now, feeling that expansion, feeling the expansion in your entire torso, your chest, your abdomen, your diaphragm, your back, and coming back with every exhalation, relaxing. Do it for another 5 breathing cycles. Once you're done with it, you can put your hands down.
I think for those of them who have done that, like joined the session from the beginning of it, they can see that now we are breathing way better after listening to the class. I think I personally observe it, like normal breathing, what we do, and now what we are breathing. Literally, we can feel the entire torso moving, your back, chest, and abdomen, everything. Usually, we just think about our lungs, or not even the lungs. Most of the times, only through your nose. It's just still here. You're not even feeling your chest move. But today, when we are practicing, we know that the entire torso moves. That is, the entire upper body moves. So this is what.
I mean, like when you block one of the nostrils and you breathe through the other nostril, it's like you're training. Even if one nostril is usually blocked, like we said, right? One is dominating.
Yeah.
So you're trying to breathe in through the other nostril, thereby, expanding your lungs a little more because you're breathing through more resistance.
Yeah, exactly.
So, and after that, when you observe your breath, it would have become a little more deeper, a little more slower. And so those are the observations. If you didn't feel any observations now, keep doing the practice. I'm sure you will.
Yeah, if they keep doing it regularly, definitely will see the change. And that is what yoga teaches us, right? Whenever you have a blocked nose, the sudden instant is you start doing mouth breathing. But if you train your nostrils this way, even if your nose is blocked, you're still doing nose breathing and still you're getting the benefits of nose breathing. As we understood through the session, that nose breathing is extremely important. And definitely other pranayamas, this is what pranayama is. There are many more pranayamas. I think they can do pranayama, breathing exercises, all of this to train your breath.
Maybe one more takeaway could be Om chanting.
Yeah.
So you breathe in deeply. As you're breathing out, you chant Om. So what happens is your slow, steady exhalation calms down your mind. And we all know that Om chanting relaxes us from, it like just relaxes us because all through the class we've been talking about long, deep breath. So, when your exhalation is this slow, steady exhalation, it's not one exhalation and then another exhalation. It's no jerks in between. It's just one smooth flow. And just that smooth flow of exhalation relaxes our mind. I think mantras are a huge topic.
Yeah.
But as far as breath is concerned and Om chanting is concerned,
we can just talk about
slow, deep exhalation.
Like when we do the yoga session, we observe that some people cannot do the long Omkara chanting. They just do Om and they stop. They give a jog. That means they have very low lung capacity and that their lungs is not expanding to how much they should actually. So beautifully said that Omkara is one where automatically you will improve your breath, and usually we say, right, exhalation should be longer than inhalation.
Yes.
Yeah, that is automatically done during the Om chanting.
Mm.
Yeah.
During exhalation also, it's like, the parasympathetic activity is more. This is also proven, like, when you inhale, your pupils dilate. When you exhale, they come back. So it's like, inhale is a little more of the active one. Exhale is more of the relaxed one.
To get more relaxation, it's important to have a prolonged exhalation than the inhalation. So that is why we just
Correct.
say in yoga also during the session, normally also, our exhalations should be longer than our inhalations. So if you have any questions, please drop us in the comments below. We'll try to answer you. And or you can also give us feedback. Like, we have touched this topic because I think most of us, being it is such a simple topic, we feel, but most of us will not know all these details. So you can give us feedbacks in your comments. That will help us to keep going, keep doing such things. Hi. Who is telling hi? Hey, everyone. Psych.
Yes.
Yeah, if anyone tell us like what do you feel about the session, that would be great. And also, if not now, you can also reach out to us. And any other message you want to give, Dr. Swati, at last?
Breathe deep, live long.
Yeah. Covered everything. Yeah, who was this? Subhashini. Thanks for the sessions. Very informative. Thank you so
Thank
much.
you. Thank you, Subha. Yes.
And if you have any doubts, please reach out to us. Both Dr. Swati and me are trying to communicate with people online, trying to put out our content, our knowledge to everyone on the Instagram platform. So you can ask us questions there. You can contact us at any time. Once again, thank you, Dr. Swati, for being with us today and
Thank you.
sharing so many valuable insights. We both were discussing that we may do half an hour or so, but
Correct.
just prolonged.
It is exactly
Yeah,
1 hour now.
and I think we can speak for another hour because there is too much to speak about. Specifically, when we people who have studied yoga for a long while, we have a lot to speak about. Yeah. Okay, please contact us, any one of us. He's suffering from cold and he's saying that he took many medicines, but it's not correcting. Yeah, definitely. This is a proof that just medicines won't correct, thus just food doesn't correct it. Having a proper breathing is also very important. So you can contact us, or you can contact any yoga instructor or a teacher who is very well trained. You can contact them. They will definitely help you. Thank
Yes, feel free to contact. Yes.
Thank you so much, everyone. I
Thank
think
you.
we'll
Thank
and
you.
message: breathe well and try to sit straight. Try to remember now and then that you have to sit straight to breathe well and live longer. Okay, thank
Yes.
you. Bye bye.
Thank you. Bye bye.